Hey everyone, welcome to another episode of Ask Dr. J, and today we're going to talk about the color of your teeth and why it matters. People ask me all the time, is the color of my teeth normal? Are my teeth changing color? Can I get them whiter? So let's talk about different types of colors, what they mean, what's going on with all this, what's going on with color. So the teeth, first off, that you see in the media, whether it be on Instagram or TV, wherever it may be, that are ultra bright, just so you know, typically those people have had some type of dental intervention or treatment, whether it be bleaching, if their teeth were perfectly straight, or even more likely would be cosmetic ceramic veneers. It's usually not natural to have that really super white, bright color without some type of dental intervention. And bleaching is an option for you, by the way. So let's talk about some other things. There's teeth often that, and it's not as common anymore, but certain people, if your mother, when she was pregnant, had a medication called tetracycline or other chemicals, can cause your teeth to be a dark gray. And these are some of the harder colors to change because the stain is deeply embedded in the tooth structure. Usually it's very hard to bleach out, and almost always to change it, you would have to have some type of ceramic treatment, bonding, something to go over the color of the tooth. There is a couple products, core bleaching is a product. I don't endorse them or I don't get paid by them, but it's one of the products that can sometimes overcome that. So let's talk about some other things. There's things external that can stain your teeth, such as supplements, coffee, wines. They're obviously going to make your teeth more brown or yellow. And some of the ways to combat that would be, number one, rinse your teeth with water after you put the substance in. Make sure you're brushing appropriately and also going to your hygiene visits at a regular basis. That stain usually is pretty superficial and can be removed with a good cleaning. On top of that, if the stain's removed and you want to, again, bump up a couple shades, you can do that with either in-office bleaching or take-home bleaching with trays. And by the way, for bleaching, the only difference between what you would buy in the store over the counter and professional bleaching is really the concentration and the amount of time. So you can only get a certain amount of concentration or strength of bleach in over-the-counter products such as Crest white strips. So those are some of the solutions. But let's talk about a couple other things that you may not be aware of. Sometimes there's a condition called fluorosis, where if you've had overexposure to fluoride, and it would have to be a lot when you're developing, you can get either white or brown spots on the teeth. And it's not a sign that the teeth are damaged or weak. It is a cosmetic concern if it bothers you. And the last thing I wanted to talk about is if you have maybe a tooth in the front of your mouth that doesn't match any of the colors of your teeth, and maybe it's darkening, that could be a sign that the tooth either had a traumatic injury and the nerve is dying, or even during complex orthodontic treatment, somehow the nerve went through transition, the nerve died, and because of that, the tooth starts to change color. That type of discoloration cannot really be changed with bleaching that you and I usually think about. It's more what we call internal bleaching, where the tooth has to have a root canal because the tooth is dead, and then inside the chamber we add bleach. It's called the walking bleach technique. Believe it or not, the tooth can get whiter in that manner. So these are some of the things that are important for color. One other side note is that your canines, your eye teeth, typically on our scale of colors is usually a half a shade darker than your front teeth and your premolars behind it. So very often, if we're doing a cosmetic rehabilitation or bleaching, that comes up. Why is this tooth darker? And unfortunately, that's just the way it is. So sometimes the only way to fix that is, again, either aesthetic cosmetic bonding or ceramic veneers. So a whole bunch about color on teeth. Hopefully this was helpful for you. And if you have any questions, feel free to hit us up with a message or a comment. Thank you for watching another episode of Ask Dr. J.